Ever squint to see distant objects clearly? Perhaps you've experienced myopia, also known as nearsightedness. It's a common vision condition that many of us might not even realize we have. But don't worry, we're here to delve into what myopia is, how it affects our vision, and the different types that exist. Imagine you're trying to read a street sign across the road, but no matter how hard you squint, the words remain a blur. However, the moment you pull out your phone to text a friend, the letters on the screen are as clear as day. This is what myopia, or nearsightedness, feels like. It's like having a built-in zoom lens for things up close, but when it comes to distant objects, they appear fuzzy or blurred. Now, you might be wondering why this happens. Well, it's all about how our eyes focus light. In a perfectly shaped eye, light rays bend or refract to form a clear image right on the retina, which is the light-sensitive layer at the back of the eye. But with myopia, the eye is a little too long, causing light rays to focus in front of the retina. This mismatch is what makes distant objects seem blurry. It's also worth noting that there are different types of myopia. Axial myopia, the most common type, is where the eyeball is too long. On the other hand, curvature myopia happens when the cornea or lens has too much curvature, bending light incorrectly. Each type has its own unique impact on our vision, but they both result in the same core issue: difficulty seeing things far away. So, if distant objects appear fuzzy while those up close are clear, you might be dealing with myopia. But don't fret. Understanding is the first step towards managing this condition and keeping your vision sharp. Wondering what causes myopia? It's a combination of genetics and environmental factors. Let's dive into this. Myopia is often a hereditary condition, which means it tends to run in families. So if your parents or grandparents were nearsighted, you might be too. But it's not all about genes. Environmental factors play a significant role as well. Spending long hours doing close-up work like reading or using a computer can contribute to the development of myopia. This is because our eyes get used to focusing at short distances and may struggle to focus on farther objects. And what about screen time? Well, while there's been a lot of talk about the potential link between screen time and myopia, it's important to note that the relationship isn't fully understood yet. While excessive screen time might contribute to myopia, it's not the sole cause. Certain ethnic groups are at higher risk of developing myopia, and if you have a family history of myopia, you're more likely to develop it too. Remember, myopia is complex, and not simply a result of too much screen time. Understanding these causes and risk factors can help us make informed decisions about our eye health. How can you tell if you have myopia? Let's explore the common signs and symptoms. One of the most typical signs of myopia is squinting. If you find yourself squinting to see distant objects clearly, you might be experiencing myopia. Another common sign is headaches, which often result from the strain of trying to focus on blurry images. Difficulty in seeing distant objects like road signs or the blackboard at school is another key symptom. Now, it's important to remember that these symptoms can also be associated with other eye conditions. So, if you're experiencing any of these, don't jump to conclusions just yet. The best way to know for sure is to consult an eye doctor. They can conduct a comprehensive eye exam to accurately diagnose if you have myopia or any other eye condition. Remember, early detection is key to managing myopia effectively. If you're squinting more than normal or struggling to see far away, it might be time to visit an eye doctor. Myopia is diagnosed with a comprehensive eye exam, but what happens after a diagnosis? Well, there are several treatment options available, and the best one for you will depend on your individual needs and lifestyle. The most common treatment for myopia is corrective lenses. These can be eyeglasses or contact lenses, and they work by refocusing light onto the retina. Eyeglasses are a simple and effective solution, but they can be inconvenient during physical activities. On the other hand, contact lenses provide a wider field of vision and don't fog up like glasses can, but they require more maintenance and care. Vision therapy is another option. This involves a series of exercises designed to improve your eyes' focusing abilities. It's especially useful for children, as it can help slow the progression of myopia. Finally, there's refractive surgery, which includes procedures like LASIK and PRK. These surgeries reshape the cornea to properly focus light onto the retina. While they can effectively reduce or even eliminate the need for glasses or contacts, they come with potential risks and complications, such as dry eyes or issues with night vision. In conclusion, while myopia can't be cured, it can be managed with the right treatment plan. It's important to discuss these options with your eye doctor to determine the best course of action for your unique situation. Living with myopia requires some adjustments, but it doesn't have to limit your life. Adjusting to myopia can be as simple as wearing glasses or contact lenses. These corrective tools can help you see distant objects clearly and go about your everyday activities with ease. Now, to manage myopia effectively, regular eye exams are key. They help monitor your vision and ensure your corrective measures are up to date. These checks are essential in preventing further complications and maintaining good eye health. Next, let's talk about healthy habits. A balanced diet, rich in antioxidants and vitamins, can contribute to overall eye health. So, remember to include plenty of fruits and vegetables in your meals. Regular physical activity can also promote good circulation, including to the eyes. Also, it's worth mentioning screen time. In this digital age, we often spend hours staring at screens. This can strain your eyes, especially if you're nearsighted. So, try to take regular breaks from screens and practice the 20-20-20 rule. That's every 20 minutes, look at something 20 feet away for 20 seconds. At the end of the day, living with myopia is about managing your vision and adapting to your needs. It's about finding a balance that works for you. With good habits and regular checkups, you can keep your vision sharp and enjoy life to the fullest.